Everyone. Thank you all for joining us in this crucial global dialogue series. It's up to us, Race to End HPV-Related Cancers, starting with cervical cancer. I'm Shobha Krishnan, founder and president of the Global Initiative Against HPV and Cervical Cancer, GAIAC, and the host for these global series, leading up to Women Deliver 2023 in Kigali, Rwanda this July. I'm delighted to be accompanied by Dr. Jessica Wells, Associate Professor of the Nell Hodgson Woodruff School of Nursing at Emory University. She will be moderating the questions and answer session for today. And thank you all very much, you, the audience, for sharing our vision to raise awareness about HPV and the urgent need to eliminate cervical cancer so that no woman is burdened by this preventable disease. And now for some housekeeping items. So there are a lot of very useful links here. Perhaps the best thing might be for you to just take a screenshot of it. But here's the summary. Audience microphones are muted for smooth flow of presentations. Please feel free to enter questions in the question and answer box throughout the session. Speaker bios, handouts, webinar recordings will all be posted on the GAIAC website, which is giahc.org. There's a brown button on our main page which says Women Deliver 2023, and you click on it, it will take you to all the information, including these links. Ongoing discussions will take place on GAIAC's Twitter platform at GIAHC. You can email us at any time. And before we proceed, our sincere thanks to our sponsors and partners from all walks of life who have brought in their support, they've brought in their resources and their expertise so that we have a global platform on which we can have these vital discussions well beyond after the conference and the event has ended. So our heartfelt thanks to you. And now it gives me distinct pleasure to introduce our opening speaker, an individual who has not only conquered audiences on the silver screen, but she's also using her own personal journey, influence, and her platform to make a positive difference in this world. Please join me in inviting our actor, activist, president, and co-founder of HPV Cancers Alliance, Marsha Cross. Welcome, Marsha.
Sorry, just unmuting myself. Thank you so much for that introduction. Thank you so much for this entire event. I found myself getting so emotional just listening to you and of course, looking at the unbelievable resumes of all you brilliant women. And I just want to thank you for doing this because many of you know my story is that I had anal cancer and I don't want to go into the treatment. We all know it's gnarly, but what was really astounding to me was that here I am, an educated woman in my 50s, and my husband had previously had throat cancer, and I am diagnosed with anal cancer, and I still don't understand that it is caused by the HPV virus. Even when I asked them to take, to make sure that was the case, they said, "Oh, we don't even bother anymore." So as I healed and got to the other side, I thought, how could I not know about the HPV virus? How could I not know about the cancers it causes? And then I thought, well, my entire life I've been going to the gynecologist and having pap smears taken. And of course, the reason you take a pap smear is to check for irregular cells, which are caused by the HPV virus. But nobody tells you that. So all these years go by and I'm like, why don't we know this? Why don't women know this? And it just was baffling to me that there was absolutely no education about it, at least in my particular generation. I know that the younger generations have been hopefully vaccinated and it's a whole different story, at least in certain parts of the world, certain parts of our country. So lucky me, I decided I really just couldn't go on with my life and not spread the word because I got to live. And if I did not have a gynecologist who A, insisted I come in when I was late for my appointment, and B, did a digital rectal exam, which took all of about 2 minutes, I wouldn't be here. And every time I do something, oh my gosh, I have 5 minutes. I don't know how long I'm taking. Every time I do something for HPV, I think of and get emotional because of the people that I know who have passed and didn't need to. I mean, we don't have a cure for pancreatic cancer. We don't have a cure for certain brain tumors, multiforme glioblastomas, but nobody needs to die from HPV-related cancers. And so that is why I'm so thrilled to be here today, where there are so many incredible women, young, older, it doesn't matter. And that we get together and spread the word to far and wide everywhere, to go in, to learn the symptoms, to go to your doctors, to go to your regular appointments. And then I had an epiphany while I was in the bathroom getting ready, which I wasn't planning on saying, and it's this: we need to involve men. Why is it all about women doing this? Like, tell your partners, tell your boyfriends, tell men that you know, because it's their girlfriends, wives, women's daughter that are getting cervical cancer, anal cancer, vulvar cancer, my husband, throat cancer. I mean, it's not just women, but it's always us. We are always the one that carries the mantle, right? But I'm saying, ask the other sex to do their part too. Anyway, I am, as I said, I'm so honored to be here. I hope that this next generation, while I am still alive, that we can see the end, or at least this many more cases only from cervical cancer. And I never want to see anybody die from these cancers. And I think that we can actually achieve this goal. And that's really why I'm here to tell you how important it is to me that we do what you are all doing, and how grateful I am for every voice, every webinar, seminar, conversation you have with another person. We can do this, and that's my word. And today I'm saying this for Tamara, who passed with 3 young boys and did not need to die. And there are so many more. So I thank you all on the panel, and I thank you everybody who's listening all over the world. I'm so grateful, and go out and make this happen. I can't sell a raffle ticket, but I can tell you to make this happen. And I will go anywhere in the world to help you. Thank you so much for inviting me to talk.
Thank you, Marcia. Thank you so much for your tireless work for raising HPV awareness. And we wish you all the very best with your health. So I believe I am the next speaker. Let me share screen. All right, can you all see my screen and hear me?
Yes, looking good.
All right. All right. Oh, sorry, we go here. Okay, so the title of my talk is Why HPV and Cervical Cancer Elimination Today. Well, what I want to do is I want to keep this more of a human interest story, and I want to keep it more of a human rights story, and what we can do on a global level, what we can do as individuals for ourselves, for our families, and also especially for our children. And I'll focus more on the low and middle income countries. I certainly hope there are some men and some members of the LGBTQIA+ community here, because you're going to find out what I'm going to say affects us all. Well, unfortunately, I have nothing to disclose. Okay, imagine if I told you that here is a cancer for which we know the cause, for which we have safe, simple, and affordable methods by which we can prevent it 100%. You're going to say, wow, that's great. But then I go on to tell you that this very cancer for which we have the tools to prevent it today takes the life of a relatively young woman between the ages of 35 and 60 every 2 minutes in this world. You're going to say, that's sad. Well, imagine no more. This is real, and the cancer is cervical cancer. So this is where the cervix is. It is the neck of the womb, and this is where that cancer grows. 99% of cervical cancer is caused by a virus called the human papilloma virus, or HPV. And because it is a virus, we have a vaccine for it, just like the COVID vaccine. And because the cervix is close to the external surface, we have safe, simple, and affordable methods to prevent it. And yet we have thousands of women who are dying around this world, an unnecessary death. So this is the map. This is the map of where the cancer is occurring in the world and where the deaths are occurring. You can see that they're pretty much parallel to one another, isn't it? About 604,000 cases per year with 342,000 deaths, which means over 50% of the women who are getting this cancer are dying from it. And what happens when a young woman dies? We all know that she leaves behind families with young children who then spiral further down into poverty and economic despair. 90% of cervical cancer cases and deaths occur in the developing world. And you might say, oh, well, that's not surprising because, the developed world is where all the advanced treatments are. Well, that's true. But do you know what single-handedly reduced the number of cases of cervical cancer in the developed world? It is the inexpensive Pap test or the Pap smear. So where we take it's a screening test where we take a smear from the cervix. So you see here that countries which had a high uptake of the Pap test, with US, UK, Australia, have lower cases. Countries which do not have an organized system for screening, like Africa and India, have higher cases. So even today, the Pap test is considered as one of the most cost-effective screening tests in the history of medicine. And by the same token, you see that countries where the HPV vaccine was introduced for about 15 years ago, their cases of cancers are coming down, whereas countries, once again, which do not have the vaccine introduction, the cases continue to rise. In fact, the cases have come down in one study by 87% if girls are vaccinated between 12 and 13 years of age. So this just exposes this glaring gap in disparity and inequities between the have and the have-nots, isn't it? And if we want to end cervical cancer, we need to get the vaccine and the screening to those people who need it the most. And that is why, given the tools that we have to prevent this top killer among women, and we still don't have equal access, makes cervical cancer a maternal child health issue, a sexual and reproductive health issue, a women's health issue, an economic issue, and above all, a human rights issue. And that is why this platform of Women Deliver members, of movers and shakers, is so important, because we need to get behind this cause and rally behind it so that we can end this devastating disease. So you might say, okay, you've kind of convinced me, but where did this virus come from? I mean, we're just hearing about it now. So let's do a little bit of journalistic work on the who, when, what, why, and see where we are, okay? And we'll start with the why. Why were we hearing about it? Because 99% of cervical cancer is caused by HPV. And what is cervical? What is HPV? HPV is a virus. It is not the HIV virus, so please don't confuse that. HPV is a common virus. 80 to 90% of people in the general population will have HPV at some point in their lives. So it's an equal opportunity virus. And the real bad boys here that cause most cancers are the 16 and 18. And there are many, many types of HPVs. Where do we see this? Now, HPV has been around for centuries. When we were growing up, we must have read fairy tales with witches with warts. Well, warts are caused by HPV, but those are the non-cancer causing warts. And how does this HPV spread? Well, it spreads skin to skin and mucous membrane. So it can spread non-sexually and sexually. Now, as soon as I say sexual, everyone's antenna goes up on high alert. But the scary part is that this virus can remain dormant or quiet for years, even decades in a person without that person having symptoms or knowing it, and then pass it on to another person who might then end up getting the disease. And who gets HPV? Well, 75% of the infections occur between the ages of 15 and 25 because it makes sense. That is the time when the exposure to it is going to be the greatest. And because the vaccine is a preventive vaccine, we want to give it before 15 to get the maximum benefits. And when does a person get HPV cancer? Is everyone, the general population getting an HPV cancer? Well, I have a little bit of good news there. The good news is most HPV infections, they clear up on their own. 80 to 90% in 1 to 2 years will clear up on their own. It's that 10 to 20% that persist. This word persistence is very important because that is the one which would progress to lead the infections to cancers. And when does it persist? It persists when a person has a weakened immune system. Perhaps they have a chronic disease for which they are taking medications like steroids. HIV, the rates of HPV cancers in HIV patients is 5 to 6 times higher. And Jessica here can tell you all about it because that is her field of work. Smoking increases the rates of HPV cancers from 2.5 to 4 times. Unsafe sexual practices. And I always add poverty as a risk factor for cervical cancer because we just saw on the maps because of unequal access and disparities and inequities to access. Apart from cervical cancer, HPV causes several other types of cancers in all genders: mouth, anal, vaginal, vulval, penile. And that is why we all have to worry about HPV because it affects us all directly or indirectly. So you're saying, okay, tell me, how can I protect myself and my family? There are 2 lines of defense. The first line of defense is the HPV vaccine. It's a safe vaccine. It's a very effective vaccine, up to 70 to 98% effective in preventing cervical cancer. And because it's a preventive vaccine, we want to give it between the ages of 9 and 14. In fact, in the US, we say 9 to 12, because it is this age group which has the strongest immune system to produce antibodies towards the vaccine. And this is also the time when the exposure to the virus is the least. So why not give it when it works best, right? And now we have a 1-dose HPV vaccine, which is a game changer. And we're going to hear all about it in our next session on July 12th. And there are indigenous vaccines now. China, India are now manufacturing the HPV vaccine, thereby lowering the cost. And Gavi, which is the Global Alliance for Vaccine and Immunization, is funding eligible low and middle income countries, whereby each vaccine costs just about $5 a shot. So here you're going to see that now the screening methods have even become simpler than the Pap test and more accurate than the Pap test. For example, and this is what we call, we go to the women, it's the point of care. Just drop off a kit, let her in the privacy of her home, take a little vaginal spear, put it back in this packet, ship it to us, and then we in the lab will run the test. And if it's positive, we'll call her back for follow-up. Women don't want to insert something in the vagina, then here we now have this clean, neat contraption for catching urine on which we can do an HPV test. And then what we can see is you can, I hope you can see, this is a handheld battery operated device that you can actually take to burn off the lesions in makeshift camps in the developing world where women live and work. And we are going to hear all about this also on our July 12th session. So here is an example of some of the partner programs that GAIAC has worked over the years. And I just want to show you the cost effectiveness of this program. And of course, I want to preface it by saying that, these numbers can vary from country to country, program to program, depends on what's included, what's not included. Look at this, $5 for a single vaccine, $25 for screening and early treatment. And you never want to screen unless you have a path for some sort of a treatment, right? How about having a Screen the Mother, Vaccinate the Child program, $30. And here you can see some outdoor initiative on education and awareness building in one of our programs in India. And what's not to like about outdoor and fresh air, isn't it? So that is why now, knowing all this, the World Health Organization has taken this on as a cervical cancer elimination as a priority. And they have come up with a global strategy to eliminate cervical cancer over the next 100 years. You're saying 100? That's a long time. But we have to start somewhere, isn't it? So they've come up with 3 pillars. The first pillar is 90% of the girls should be vaccinated by age 15, and 70% of the women who are in the eligible age should be screened with a high performance test once at 35 years of age and the next at 45. And you're saying, wow, that is a long interval for screening. But guess what? In general population where the immune system is good, HPV is a very slow growing cancer. And that is why even in the developed world like the US, we are spacing out our screening tests of pap smears and HPV tests just because of the nature of the progression of this cancer. And the WHO continues to say that at least 90% of the women who have the disease should be treated. And if we do this, see what happens over the next 100 years. We eliminate it in 2120. But see where the initial drops are going to come. It's going to come from the screening and early treatment, because there are so many women now who have not been vaccinated, or we are past the vaccination age. So how are we going to prevent cervical cancer? We are at risk, right? So that is by screening early treatment so that it doesn't proceed to invasive cancer. And see what happens in the next 30, 40 years. The girls that we are vaccinating now between 9 to 14, they will become 30, 40, and 50 years old, and we will see less and less and less of cervical cancer. And 2120, hopefully, will be the end of it. And, lucky are those who are going to be there to see that day, but at least we can take pride in saying that we set the stage for it, isn't it? So to prevent cervical cancer, both HPV vaccination and screening is important, and we should pay attention to both. So now you're saying, okay, that's all great. You've convinced me, but give me specific messages that I can take to my community and talk to different segments of people in my community. Call to action. Parents, the HPV vaccine works. It's a safe vaccine. It's an effective vaccine, all the way up to 98% effective. There is an added incentive to vaccinate on time. The closer we do it to 9 years of age, the better the immune system will produce antibodies. And as parents, we want to protect our children. We know that we don't have control over everything that happens in our lives or everything that happens to our children. We also know that we will know everything about the person that our children have a relationship with, either willingly or unwillingly. Unfortunately, sexual assault happens in many parts of the world. And what does this virus do? It transmits itself quietly from one person to the other without any symptoms in that person, but the one who gets it, unfortunately, can end up having disease. And as parents, it's natural for us to protect our children from as many things as possible, isn't it? Providers, an effective and strong recommendation from you is the best for uptake, because patients trust you, and you're the ones who can deliver this message to them in a culturally sensitive manner. Teachers, where the best vaccine uptake is? When it's given on-site in schools with community-based education. So please encourage school-based vaccination. Politicians, yes, politicians, we know you run it as a business. Then let's talk to you in your language. Look at the return on investment. $3.20 for every every $1 you invest, because more and more women are entering the workforce. And $26 for every $1 you invest because of women's improved health on families and society. Let's use our influencers, like First Lady Dr. Bagadoo, who's going to talk to us very shortly. And she can influence lawmakers, right? Re-emphasize that women are the backbone of economies. And politicians can really easily take credit for this. With a little bit of political will and funding, HPV is a low-hanging fruit. It's the best bang for your buck. And a small investment goes a long way. Patients, tell your stories, most powerful. Marsha just did that. And there's another very powerful movie that you might want to watch called Lady Ganga. Men as allies. Well, aren't they the culprits in most cases? So tell them that they should protect women in their lives, their mothers, their sisters, their daughters. Men themselves can get HPV cancer. And if they protect enough women in their communities, guess what? They can indirectly also be protected by what we call herd immunity, because the viral pool in that community will go down. But of course, because men get HPV cancers, in an ideal world, we want both boys and girls and boys to be vaccinated. Young leaders, it is your generation that is going to end the very first cancer. You are powerful, creative, passionate, social media savvy, and Women Deliver has a huge group of young leaders. Get the vaccine, be proactive, be a part of the moonshot. And if any one of you wants a platform, the young leaders at GAIAC will welcome you with open arms. And thereby, you will have one less worry in your life, which segues very well into our next speaker, who is Anita Wiseman. She's the consultant for the International HPV Awareness Day, and she's going to tell us how to get into the very first step of prevention, which is awareness. Over to you, Anita.
Thanks, Shobha. I'm going to just bring my deck up here. And thanks very much for that really great overview of the issues and what we're all up against and working towards. And it's great to see the data and the solutions that are available. But I'm here today to really talk about one part of the picture, which is really around increasing public awareness and knowledge of HPV, so that and your presentation started about knowledge being power, and really the aim of our campaign is to really make sure that everyone is empowered with the information that they need to make positive health choices. And really it's so important. I think, it's so important from the point of view of, yeah, sure, we want to make sure that people have information to make decisions, but we also, women and other people affected by HPV have health rights. They have a right to make decisions and to get access to information that enables them to make decisions that protect their health. So we really see that as part of our work here at the HPV campaign. So I'm just going to run through some of our work and share with you what we've been doing over the past 6 years. I don't have any personal disclosures, but I do have to let you know that our campaign is made possible through funding from industry contacts. So we're funded by Abbott, Attila Biosystems, and Roche, who all have interest in the cervical screening arena. So why are we running a global HPV awareness campaign? Well, I've said about the health rights, but then there's also the very practical reason. And this is Paul Bloom, who's the Senior Officer for Immunization and Adolescent Health at WHO, who said, why would any young girl get a vaccine against an infection she's never heard of? And why would parents allow their children to be vaccinated against HPV if most have never heard about the virus and don't understand the connection with cancer? So let's build awareness as a key step to improve uptake of HPV vaccines. And we feel that that's also the case for screening. Women need to understand the importance of screening, and they also need to increasingly understand, as HPV screening is put in place, what that means and what they're being tested for. And our past president of the International Papillomavirus Society, who is the owner of the kind of facilitator of the HPV awareness campaign, Margaret Stanley, who has a long history as a researcher in HPV. She's been a solid supporter of our awareness campaign. It's not just cervical cancer, it's a range of cancers. And as we heard, it causes anal cancer. The cancers associated with HPV affect women and men. And while the biggest burden is held by women, there is work to be done there by men and for men. So we really feel that this is as Margaret says here, HPV is a true equal opportunities virus. we need to take action to raise awareness and make sure that that happens across the board. So there, we've said about our vision, a world where everyone is equipped with the knowledge they need to share to take effective action. And we work from a series of principles, which is that HPV affects everyone, by talking about the virus of HPV, which is so endemic. You know, almost all of us will have HPV at some point in our lives. In some ways, it's something we all have literally skin in the game for. We all have some interest in knowing more about it, and that is unifying and provides us with an opportunity around conversations. We also, through our campaign, we work with a really diverse partnership, and we think in a very global, our message is global, it's very unifying, but we also realize that there are specifics to local circumstances, there are specific communities that experience particular barriers, and we work to develop campaign approaches to awareness raising that are responsive to those differences. And we also are committed to delivering campaigns with a measurable impact. This is quite a hard one. It's hard to do. It's hard to make a line between awareness and behavior change, but we're looking very closely at how we can do that and how we can make sure that that happens. And that's done a lot through the conversations we have with our partners. So more about our partners. We realized IPVS is a scientific society. We've got amazing scientists. They don't necessarily have the community and civil society networks that are helpful in raising public awareness. And so the first step that we took was to really look at building a global coalition that could work together to raise awareness of HPV and to look at how we can address that through vaccination and screening. So you can see now we've got a really broad spread, over 130 partners in 54 countries. There are variety. Some of them are very large organizations with well-known and scientific organizations, and some of them are quite small community organizations established by people directly affected by HPV and really committed to raise awareness, and we have a variety in between. We have youth-focused organizations, we have women's health focused organizations, and we have men's health-focused organizations. So you can find out more about all of those on our website. And what we do is we work really closely with those partners to equip them with campaign materials and guidance and help them in their efforts to raise awareness of HPV. Our work's focused on March 4th, which is HPV Awareness Day, but these resources are there for use all year round. They're widely translated. We've got materials you can see here. We have a campaign guide that has messaging and how to use our brand. We have a youth playbook that highlights specific things that young people can do to help take the message out around HPV. We've created our brand, our campaign brand, One Less Worry. I won't even try and say it in Spanish, but we have that translated into a number of different languages. We have infographics, which provide the kinds of information that Shobha was sharing around HPV prevalence and mortality and impact, and we share those too. And we have promotional videos focused on vaccination and screening, posters for clinics, and then on our website we also provide direct information direct for patients and caregivers and anyone with an interest that really looks at some of the most commonly asked questions about HPV. We curate some of those into specific pages so that we have specific pages for particular communities as well. So that's all on our askaboutHPV.org website. And for HPV Awareness Day, we have a focus on each of the 3 pillars of the cervical cancer elimination strategy. Oh, sorry. So our aim is to make sure that we are, with our campaign and messaging, supporting that global goal and moving towards a future where nobody has to experience a preventable HPV cancer. So you can find here, we try and make the campaign as visually interesting as possible. We've gone with our One Less Worry brand because we feel that this came to us after COVID, and really there was enough anxiety in the world. We kind of feel like the world is in perma-crisis. There's either there's climate, there's COVID, there's economic disaster, there's conflict, there are all sorts of things that we could be worried about in the world, but there is an opportunity here to rid ourselves of one really significant worry, and that's HPV cancer. So we have videos, we have posters. I can share run one of the videos for you so that you can see that here. This is our vaccination video. If that's going to run. Yeah, here we go. Oh dear, we're in a loop. Here we go.
Oh, we're not able to see it
You're
this
not
way.
able to see it. I'll stop share. Sorry about that. That's a pity. For some reason, my screen sharing was paused while I ran video. It may be a security setting. I'll go back to this. So yeah, you can see we have a mixture there of emotionally appealing posters. We also have some posters that are much more, and this is across the board on our resources. We have emotional and factual responses to HPV. So, and those are there to be used by anybody that wants to use them. Our partners are able to, all of the partners that we're in a formal relationship with, they are able to, as part of our Think Global, Act Local, they're able to take these resources. We send design files, we share those, and people are able to develop with their own images, their own content and messaging, and to really make this campaign their own. We work, because we understand, we work so we have this, we also have a centralized social media and digital advertising campaign. And you can see here some of the examples of how that plays out. So we have here a TikTok influencer. We don't have our own TikTok channel. That would take quite a lot for us to run. And we'd also have to have somebody, I think, who's a bit more charismatic than anybody who's currently on our campaign committee who would take that forward. So we're still looking for a volunteer there. But we go out and we try to identify people who want to speak about topics that are in our arena. So women's health, sexual health, healthcare rights. And we also look at specific geographical reach on these individuals, and we reach out and connect and ask them to help support. So here we had, this is an influencer called Dr. Chris May.
Excuse me, Anita, you have 30 seconds to wrap up.
Okay. And she's based in Barbados. This is a TikTok dance challenge that was initiated by our members in Singapore and taken forward by the Commonwealth Health Use Network. So we got that wider. And here we have a doctor who's a trans influencer, a trans doctor who works with that community to really raise awareness of the need for HPV vaccination and screening. And you can see here some of the translated materials that's there so that people
so
can
if you give us all this information, we can also upload it for you there's a link there on our website at gaiac.org. So what we'll do now is to showcase two programs that recently adopted this IHAT campaign, and it is my honor to invite Her Excellency First Lady Dr. Zainab Bagadu of Kebbi State, Nigeria, who is also a board member for the Union for International Cancer Control, to talk about the campaign in their region. Over to you, Dr. Bagadu.
Good afternoon, everyone. Can you hear me? Can you see me?
Yes.
we
Good.
can.
Okay, okay. Good afternoon, and thank you for asking me to speak at this very important webinar, GAIAC and Women Deliver. Like we've heard a lot of things about the Women Deliver platform, it offers us an opportunity to increase the messaging around HPV and in particular cervical cancer. I come from Nigeria, the most populous country in Africa and the most populous Black country, where cervical cancer is an issue. And so through my foundation and various other platforms, we have been working on how we can make this whole narrative better at various levels. I'm going to speak from different perspectives of being the spouse of the former governor of the state, Kebbi State in Northwest Nigeria, and also the chairperson of the First Ladies Association Against Cancer of Nigeria. It's an initiative of spouses of current and former governors, and the founder of Medicaid Cancer Foundation, and of course my work with the UICC. Okay, I need to share now. Thank God I have a daughter who's going to help me do that. It's always very helpful.
If you also need, I can also share your slides for you if you would like.
I think we're fine. She's got it. Can you see it now?
Yes, we could also see your part of your Zoom screen.
Yeah, now
Okay, there we
perfect.
Okay. There,
Well,
okay.
congratulations to
I
your
don't
daughter.
Well done. I don't have any disclosures, and I'm not going to go through the science of HPV. As a background, we've already heard quite a lot about it, as well as the WHO initiatives, parts of which Kebbi State and Nigeria is part of that initiative, and we're running some of the programs. In Nigeria, the most common cancer is breast, in women, followed by cervical cancer. And we have 12,000 women diagnosed every year, new cases, of which 70% of them end in death. There's currently no vaccination on the national vaccination system, although we're expecting that to change this year. Despite the size of Nigeria, we haven't been able to get on board the Gavi train to have HPV vaccination delivered. But that has changed through a lot of work by advocates and civil society, of course, the government and the responsible agencies. And later this year, we're going to be rolling that out. And our worry now is how much the demand is going to be and how the uptake is going to be. We started working in awareness through the Medicaid Cancer Foundation, and through that platform, we've been able to do a lot of screening, vaccination, as well as diagnosis and treatment support. We work with schools, with community leaders, such as the traditional and religious leaders in our environments. Our schools-based program started as a school health club, where we teach girls in particular about health issues surrounding cancer, how to live a healthier lifestyle, exercising, and safe sexual habits. We moved on to cervical cancer and most of all the HPV vaccination. So as a natural progression, we were able to carry out a pilot vaccination in Yauri, Kebbi State, which was really very well accepted. We had 3 at the time. The recommendation was 2 or 3. So we opted to go with the 3. And even though the last dose came during the COVID pandemic, our follow-up results showed that it was very well accepted, and we're still being asked to do more in that regard. So we're very confident that when the vaccine is introduced as a routine vaccination in Nigeria, Kebbi State is one of the pilot states. There are 16 pilot states out of the 36 states of Nigeria. We're confident that the uptake in Kebbi is going to be optimal. Like I mentioned, we work with the traditional rulers in our environments to send the message. They carry very strong voices. These are the emirs of Argungu and Yauri, and they're very highly educated people as well. So the emir of Argungu is a polio champion that has been recognized globally, and the emir of Yauri himself is a professor of biochemistry and totally understands the need to have these protection, and they add their voice to our campaigns, and it helps us to get the influence we need in the communities. Like I mentioned, we've been able to carry out a pilot study on 100 girls in a secondary school in Yauri in Kebbi State, and we were able to publish this as well. And we know that when the vaccine comes to the state, we're going to have a lot of demand for it. The State Cervical Cancer Control Program started an initiative in 2021 as part of the CHI implemented UNITAID funded program that is going on globally with additional support from the World Health Organization and the Kebbi State government. We were able to launch a screen and treat program for 5,000 women, and this was increased with 30,000 more, so a total of 35,000. So far, we're still at 22,000, and we're using 10 selected facilities, although it's available all through the state, but we are hoping that this uptake will increase. Basically, it entails awareness, screening using HPV, as well as treating any suspicious lesions using the thermal ablators, which you saw earlier. Through the program.
Thank you. Dr. Bagadu, if you can wrap up in 30 seconds, please.
Okay, oh, that was quick. So I think basically the message is the same. Cervical cancer is an eliminatable disease as long as we use the tools that we have at our disposal. And we have these tools, and it's just about getting it. I'll end with some motivation from a famous American writer, Helen Keller, who's also a disability activist.
Oh, there she goes.
And basically, Helen Keller said, alone we can do a little, but together we can do so much more. So by coming together, by the year 2050, 1 in every 4 persons on Earth will be an African. If we can address the health issues that we have in Africa and other low middle income countries, then I'm sure that we will be able to eliminate cervical cancer in the targeted time. Thank you very much.
Thank you so much. And I think you really pointed out one important thing of the local rulers, local chieftains. It's so important to influence them and educate them, because in many parts of the developing world, or even in the developed world, it's the local influencers that we really need to educate so that they can have better. And thanks again for your mentorship and leadership, Dr. Bagadu. So we are going to now showcase our second program, and it is my privilege to invite Dr. Ibtihal Fadil. She is a board member of the Global NCD Alliance and also a consultant to the Ministry of Health and Prevention at United Arab Emirates. Welcome, Dr. Fadil.
Thank you very much. Thank you, Shaba. It's really a great pleasure to join you today in this virtual session. And I am on behalf of the HPV-MENA Coalition and the Regional Alliance. I would like to thank you for providing the opportunity to speak about the regional perspective. Here is my disclosure, nothing to declare. I would like to say a few words about from the regional perspective, which really influence our work in awareness and campaign in the region. So HPV cervical cancer remain a significant public health concern in the MENA region and the Eastern Mediterranean region. When I say Eastern Mediterranean, because we are 22 countries and the MENA refer to Middle East and the North Africa region. It's a similar sort of structure. Cervical cancer is the 6th most common cancer in women in the region. And unfortunately, there is 1 woman death every minute in the region from cervical cancer. So cervical cancer prevention in the region has a major challenges. There is a disparity and issue of equity. Both, if we take the region, the MENA, the Eastern Mediterranean region, out of 22 countries, currently only 7 countries have introduced the HPV vaccination program, and 2 of them in the last month only. In terms of, we go to the incidence and mortality of the cervical cancer in the region, we found that based on the data 2020, nearly 90,000 women diagnosed with cervical cancer. Only half of this number lost their life because of the cervical cancer. So there is an issue of incidence mortality ratio. We know that most of the country in the region have a similar cultural, religion, and conversation, in an issue concerned with the sexual behavior. So this is, though they have shows in lower incidence of sexually transmitted disease, as well as a lower incident rate of cervical cancer compared with the global figure. Having said that, we know that there is this character. We know some of the country, of the region, will have issue with data quality and data completeness. Secondly, with the migration and global changes, as well as with the current unsettlement, we might expect an increase in the incidence of sexually transmitted disease, including HPV infection. Another issue we want to talk about is the challenges. As a civil society working in the region, we are very much concerned with the challenges, and we know the challenges in the region, as well as the opportunity to eliminate cervical cancer and HPV-related cancer. So we have an issue, as the previous speaker mentioned, about lack of awareness among the community, as well as a public health, as a health professional. There is a limited screening program, a cultural and social barrier and stigma related to HPV infection, and the weakness of the health system, especially in a country which is half of the region, country of conflict and war. Similarly, if we look about opportunity in the region, we know there is the HPV vaccination program, which they need to be invested in and introduced in the region more widely. There is the regional strategy for cervical cancer elimination. This is a clear roadmap for the country to use. And also there is the platform of COVID vaccination, which could be helpful for the future use of HPV vaccination. So as a civil society working in the region, we focus on raising awareness and doing a lot of a campaign in the region. I'm talking on behalf of different countries which are currently active in regular, continuously doing a campaign to raise awareness about cervical cancer, and they are working heavily in area of improved communication and social mobilization. There is a community awareness program. We are very much as a HPV MENA coalition. Sorry for the limited time. There is a flyer about HPV coalition. I would like to invite you to see this more detail about the coalition in the region, which is currently actively working in area of focusing on raising awareness, advocating for HPV, reducing the HPV-related cancer, as well as improve the vaccination uptake in the region, and most importantly, creating and fostering a patient support group. Whatever we do, I mean, we think we are supporting the regional strategy. Again, the regional strategy is built mainly with the work, with the consultation with the civil society, and the regional strategy focused on the 3 pillars which you have mentioned: the screening, the prevention, and the treatment. And the 3 areas has to go together. And most of the country, they are lacking and limited resources to apply these areas. So civil society working jointly with all the sectors, including WHO, support them into achieving that and implementing the strategy. Still, we believe as a civil society, we believe the road is still a long way to go, but our mission is to live in a region free of HPV-related cancer. Thank you. Over to you.
Dr. Christian?
I'm sorry. Thank you, Dr. Fadil. Truly appreciate what you had to say. And your flyer is uploaded on our site at giahc.org. There's also another very good publication from Union for International Cancer Control, as you know, Dr. Bagadu, where about the myths and misconceptions in the Commonwealth. So that's also being uploaded for the audience convenience. So we always save the best for the last. And so here it is to our young leader of GAIAC and also a member of the American Medical Women's Association, Ariana Montes de Oca. Ariana, take it.
Thank you. Give me 1 minute. Can you guys see my slide?
Yes.
Yes, let's go.
Awesome. Good day, and thank you so much for having me. I'm so honored to be speaking with you all. Today, I will be representing two revolutionary organizations, the first being the Global Initiative Against HPV and Cervical Cancer, and the second being the American Medical Women's Association. Through these two institutions, we believe that through education and awareness, we can eradicate a type of cancer that is taking the life of a young woman every 2 minutes. And together, you all can help us fight this cancer. Founded in 2010, GAIAC works towards raising HPV awareness and eliminating cervical cancer through education and empowerment of international stakeholders. GAIAC is a vocal advocate for HPV vaccination, screening, and expanded access to early treatment with the aim of making cervical cancer a disease of the past. So you might be asking, how do we do this? Well, our Young Leaders program provides a global platform for students of all genders who engage with and help fulfill GAIAC's mission through 4 areas. The first being social media campaigns and artistic work. The second being advocacy and HPV awareness efforts. The third being community-based education. And finally, collaboration with global agencies on cervical cancer initiatives. Such undertakings allow GAIAC young leaders to raise awareness about HPV and its related cancers on various dates throughout the year. These various dates include Us versus HPV Week, World Cancer Day, International HPV Awareness Day, World Immunization Week, and finally, Cervical Cancer Elimination Day. To mark these dates, let's see how our young leaders participated. On the left, you will see the Women Deliver Conference in 2019, a flyer for it. One of our middle school young leaders made this for the Walk of Cervical Cancer campaign hosted in New York, New York. And on the right, you will see to celebrate Cervical Cancer Awareness Month, one of our high school young leaders debuted her Dance for a Charity in Tucson, Arizona. Likewise, in Honor and IHAT, our pre-medical young leaders made social media posts to mark the day. On the left is a flyer that we made in honor of the IPVC 2023 conference. And on the right are a string of tweets that we pulled from our Us versus HPV series that shines light on tools to eliminate and prevent HPV. Accordingly, we have partnered with AMWA for the past 5 years to host Us versus HPV Week. This year, over 500 registrants attended this 1-week webinar series, which focused on the importance of addressing disparities in cervical cancer, innovations in global prevention, and finally, new information on HPV-related cancers, among other topics. And before I go, I would like to leave you with our cervical cancer theme song that one of our medical young leaders made. We are asking students to improvise on this song. So if you would like some more information, please use the contacts that you see on the slide.
Calling all young women all across the globe. World Health Organization is proud of men to give us hope. Vaccination, screening, treatment, 3 steps that you can take. Did you know that having HPV can increase the probability of cervical cancer, but you see, it's within your power to be safe and healthy.
Yeah,
Safe and healthy.
yeah.
Cervical cancer eliminated all across the globe. You can do it. Vaccination screen. You can do it. Beat this virus. You can do it. Vaccination screening treatment. Beat this virus. You can do it. You can do this.
Yeah,
We can do this.
yeah.
We can do it. We can do it. We can do it. We can do it. Join the movement, men and women. Beat this virus, HPV. Beat this virus, HPV. Beat this virus. Vaccinate.
Overall, GAIAC and AMA are honored to provide a platform for young leaders like myself who are interested in eliminating cervical cancer in this generation. If you're interested in becoming a cervical cancer champion, please visit gaiac.org or scan the QR code that you see on the screen. This marks the end of my presentation. Thank you for listening, and I hope you all have a wonderful rest of your day.
Thank you, Ariana. Thank you to you and to the young leaders who are doing such a fabulous job in spreading awareness. So now we will move on to a question and answer session that Jessica will be moderating. Over to you, Jessica. You're muted.
Thank you. Thank you, Shaba, and all our speakers on the panel and spreading the word and awareness about HPV so we all can join together to really fight HPV and realize a world without HPV and its burden. So I will take a few Q&A in the Q&A box. There's a few leaders from organizations that want to just spread the word about their organization that's helping to fight against HPV, including No Taboo, a French nonprofit organization dedicated to HPV anal cancer. Thank you and for sharing your organization. And Anita, who's with Ask About HPV, may reach out to you. Also, EPOC African Foundation, another organization in Nigeria and Africa, servicing women, youth, and girls' well-being. And we also have a few other organizations such as MENA, who you can follow on Twitter at MENA HPV. We will share the recordings and the PowerPoint on the website, on the GIAC website, so you can access the information and some of the links that were shared in the PowerPoint presentations. And also I also want to highlight our session for our session 2, which will do a deeper dive into screening and vaccination for HPV. So please be sure to tune in if you have any questions directly related to action, how we can actually combat the HPV. So if you have any questions, please put them in the chat box. Otherwise, we'll reach out to you all with those who are part of organizations and how we can partner with you all to lead the fight against HPV.
So thank you, Jessica. Yes, we will be posting the full webinar on our website, giahc.org. And please do attend the next session. And we would love to have you experts there for your expertise and your feedback. July 12th, which is a Wednesday, we start an hour earlier. And we will also continue this conversation on our Twitter platform at GIAHC. So like Jessica said, the next session will focus more on HPV and vaccination screening programs from the different regions of the world. We will also once again have a young leaders segment, and we will have a question and answer segment. So until then, let's keep raising awareness about HPV. Thank you all and goodbye.
Thank you.
Thank
Thank
you, Masha.
Thank you.
everyone.
Thank you, Marsha, Dr.
Thank
Fadil,
you.
Dr.
Thank
Dr.
you
Fadil,
all.
Eid Mubarak, everyone.
Ariana. Thank you all. Thank
Thank you.